Good morning, Mom. I'm your mentor today. I'm Miss Ruby Catalan. What is your name? I'm Irish Biglayan from Balili, Kapatagan and 19 years old. How about your birth date, Mom? July 8, 2001. Mom, I will withdraw blood CBC. So these are the procedure. First, review and accession the request form. Second, approach and identify and prepare the patient. Third, verify the patient's diet restrictions and latex sensitivity. Fourth, sanitize hands. Fifth, position the patient, apply the tourniquet, and ask patient to make a fist. Sixth, select vein, release tourniquet, and ask patient to open fist. 7. Clean and air dry the site. 8. Prepare the equipment and put in gloves. 9. Reapply the tourniquet. Uncup and inspect the needle. 10. Ask the patient to remake a fist. Uncoil the vein and insert needle. 11. Establish the blood flow. Relay the tourniquet and ask the patient to open fist. 12. Fill, remove, and mix the tubes in order of blood draw or fill the syringe. 13. Place gaze, remove the needle, activate the safety feature, and apply pressure. 14. Discard the collection unit, syringe needle, or transfer device. 15. Label the tubes. 16. Observe special handling instruction. 17. Check patient's arm and apply bandage. And the last 18. Dispose or contaminated materials. Dermal puncture procedure. First, review and check accusation test request. Second, approach, identify, and prepare the patient. Third, verify diet restriction and latex sensitivity. Fourth, sanitize hands and put on gloves. Fifth, position the patients. Sixth, select the puncture or incision site. 7. Warm the site in necessary. 8. Clean and air dry the site. 9. Prepare the equipment. 10. Puncture the site and discard the lancet. 11. The first blood drop should be wiped away because it may contaminate with excess tissues fluid. 12. Fill and mix tubes or containers in the order of draw. 13. Place gaze and apply pressure. Keep the incision site elevated. 14. Label specimen and observe special hand instructions. 15. Check the site and apply bandage. 16. Dispose of used and contaminated materials. 17. Think patient. Remove gloves and sanitize hands. And lastly, transport the specimen to the lab. Thick smear procedure. First, place a small drop of blood in the center of the pre-clean labeled slide. Second, use the corner of other slide. Spread the drop in a circular pattern until it is the size of a dime. Third, a thick smear of proper density is one which, if placed over newsprint, allows you to barely read the word. 4. Lay the slides flat and allow the smear to dry thoroughly. Insufficiently dried smears can detach from the slides during staining. Routine smear procedure. Place a small drop of blood on the pre-clean labeled slide near its prostrate end. Second, bring another slide at a 30 to 45 angle up to the drop. Allow the drop to spread along the contact line on the two slides. Third, quickly push the upper slide toward the unfrosted end of the lower slide. Fourth, make sure that the smear have a good feathered edge. This is achieved by using the correct amount of blood and spreading technique. Fifth, allow the thin smear to dry. Dry much faster than the thick smear and are least subject to detachment because they will be fixed. 6. Fix the smear by dipping them in absolute methanol. Proper hygiene is the most important thing you can do to prevent the spread of germs and to protect yourselves and others from illnesses. When not done carefully, germs on the fingertips, palms, and the thumbs, and between fingers are often missed. This video demonstrates the technique for hand washing. Wet hands with water. Step 1. Apply enough soap to cover all hand surface. Second step, rub hand palm to palm. Step 3, right palm over left dorsum with interlaced finger and vice versa. Step 4, palm to palm with finger interlace. Step 5, backs of finger to opposing palms with finger interlace. Step 6, rotational rubbing of left thumbs claps in right palm and vice versa. Step 7, rotational rubbing backwards and forwards, which claps finger of right hand in left palm and vice versa. Step 8, raise in the water. And the last step 9, dry hands thoroughly with a single-use towel.